All right. I think we're live. Yay! Okay, so we are trying out new software, and my plan is I think this is like the millionth time I'm going to try this. My plan is to go live every Monday and just spend 15 to 30 minutes with y'all um, discussing some medical topics. I think my plan is each time I'm probably going to talk about a couple of relevant studies that have come out and just a few topics, and then open it up for Q&A if there is anybody that has questions. So if you already know that you have questions, go ahead and type them in, and that way I'll have stuff to address. But I want to start with, for those of you that don't know me, I'm Dr. Yami. I'm a board certified pediatrician. I'm also board certified in lifestyle medicine, and I'm a national board certified health and wellness coach. And I own Nourish Wellness, which is a pediatric practice. We do primary care pediatrics with a lifestyle medicine emphasis. So I'm here because I just love educating and sharing the wealth of knowledge when it comes to lifestyle medicine and the things that we can do with our nutrition and our lifestyle to decrease our risk of chronic disease, starting in childhood, starting in pregnancy, starting before your child is even born. But there are opportunities all along the way, and it is never too late. So that aligns perfectly with the two studies that I am going to be talking about today. So the first one is from the British Journal of Nutrition. It was published January 5th of this year. And it is called Associations of Childhood Diet Quality Scores with Arterial Wall Stiffness and Carotid Artery Intima Media Thickness in Adolescents, Early Adulthood, Findings from the ALSPAC Cohort. Okay, so yeah, that's very confusing, very long title there. But basically, what they did in this study is they assessed children between the ages of 7 and 13. So at age 7, at age 10, and at age 13 years old. And they looked at their diet. So they assessed their diets just from doing dietary interviews and tried to characterize their diets using 5 scores. So they used the children's Mediterranean style diet Z-score, the children's dietary inflammatory Z-score, the DASH diet Z-score, and the children's Eat Well guide. And based on that, they determine, does a child have a healthy diet, which in general is going to be eating lots of fruits and vegetables, higher fiber, higher whole foods, or do they have an obesogenic diet, which is going to be low fiber, high fat, high refined sugar, high in calorie density. So they were able to categorize these children at that age, and then they assessed them again at age 17 or 24 years by doing what's called pulse wave velocity and carotid intima media thickness. So basically, they were looking at their blood vessels to see if their blood vessels started to get hard, basically stiff. So arterial stiffness. So we know that with time and with stress to the blood vessels, and that can come from higher blood pressure, it can come from what's in our bloodstream, the cholesterol and all of that, it can cause the arteries to become stiff. And that is a sign that there is stress to the blood vessels that eventually will probably lead to plaque and atherosclerosis in those blood vessels. So they looked at that, but they also looked at the thickness to see if it was already starting to get thick and showing signs that there was already atherosclerosis in those blood vessels. And so what they found when they did this study is that the children that had the more obesogenic diets, the diets that were low in fiber, high in calorie density, high in fat, sugar, those kinds of things, they had more stiffness than the kids that had the more anti-inflammatory style diet. They did not find any differences in the carotid intima media thickness, which is a good sign. That's good news. That means that there is still time to make changes, that it's not gotten so bad. But it also means that, yes, we are already seeing signs based upon the diet that a child is eating that there is stress to the blood vessels. And you know that that takes years to decades to set in before we start having symptoms and potentially chronic complications for some people. But it starts early. So I think the whole point of this study is to just remind you that what we eat matters, and it matters from the beginning. So the best gift that we can give our children is these habits and behaviors to help them with learning how to eat more whole plant foods, fruits, vegetables, whole grains, beans, nuts, and seeds. So those are things that we can do from the beginning. Like I said before, pregnancy, while you're pregnant, while you're breastfeeding, in your infant, toddlers, the sooner you can start, the better, but it's never too late. Okay, the second study that I want to highlight is called, well, it was published in JAMA Pediatrics. So, Journal of the American Medical Association, their pediatrics journal. And it was published January 16th, so just hot off the press. Consumption of 100% fruit juice and body weight in children and adults, a systemic review and meta-analysis. And the reason that I want to point this out, although I think it's becoming a lot less common as a belief, but I would say when I started practicing, 13, 14 years ago, it was still commonly believed that we should give children juice for health reasons because it has vitamin C, or it's like, juice, whatever. So this study, what they did, it was a systemic review and meta-analysis. So they actually pulled a bunch of studies. So 42 studies, 17 were pediatric studies and 25 were adult studies. And what they found when they got all of these studies together and they analyzed them and they did their little fancy analysis to find the results was that there was a positive association between drinking 100% fruit juice. So this isn't even your juice that has added sugars and added stuff. This is 100% fruit juice and weight gain in children. And a positive association means if you drink, the more 100% fruit juice you drink, the more weight gain you're going to have. They also found that in adults, there was also a positive association with drinking juice and weight gain. So what that means is that juice is not a health food. So I do not recommend juice drinking in children as a regular thing. It's one of those things that I think can be reserved to birthday parties and celebrations. But really, it shouldn't be thought of as a health food. I would rather children eat fruit, eat it in their whole form, because then it's going to have the fiber. It's going to have more nutrients in it than the juice. So whenever you think of juice, think of it as a processed food. And the more processing a food has, the higher in calorie density it has, and the easier it is to overeat it. So just think about how many apples does it take to just make one glass of apple juice that you can just like drink it in like 15, 20 seconds, especially little kids. Like they take those juice boxes, and I feel like as they suck on it, like their whole face, everything just like sucks in, and it's like 5 or 10 seconds and they inhale the whole thing. Versus how many apples do you think that child can eat if you just gave them unlimited access to apples? Do you think that they would eat the same number of apples as it takes to make one glass of juice? Unlikely, because they would get full, they would get bored. It's not as fun. It's not quite as sweet. Whenever you're concentrating it down by just taking out the juice, taking out the fiber, it's just easier to overconsume. So I do not consider fruit juice a health food, and it should be reserved for special occasions, for every once in a while. And definitely it should not be eaten or drank on a regular basis. So instead, eat the fruit. So, all that being said, what is the healthiest beverage? So, the healthiest beverage for a child in between meals, so in between meals and snacks, is water. So we know that our infants under 12 months of age, most of them aren't drinking a lot of water, especially if you're under 6 months. You really shouldn't have any plain water at all. That's just going to be breast milk and formula. After 6 months, you can start having some water. And I love that babies start practicing with their cups, whether it's a sippy cup, a straw cup, or an open cup, drinking their water at their meals. But really, once you're over a year of age, in between meals and snacks, it should just be water because water doesn't have any calories. It's going to help protect the teeth. It's not going to fill kids up because what happens if they drink juice and milk in between meals and snacks is when they come to their eating opportunity, guess what? They're not hungry because they're full of calories. So, all of these caloric beverages should not be consumed in between meals and snacks. So, that is the healthiest beverage for children. It is water. Okay, and then let's see, what time is it? So, I'm about few minutes in here. If you have any questions, post your questions. I have to toggle back and forth between we're doing the Instagram streaming thing, so trying this out for the first time. So if you're on Instagram and you have questions, just type them into the chat box, the comments there, and I'm happy to answer them. What is the simplest principle to follow for a healthy diet in children? The simplest principle to follow is to center your diet on whole foods. Really, if you just see foods as whole or minimally processed and ultra processed, stay away from the ultra processed foods. Those are just every once in a while foods. Eat your whole foods. And you want to concentrate on fruits, vegetables, whole grains, beans, nuts, and seeds. Obviously, if you have a toddler, you want to stay away from the choking hazards. So, nut butters instead, nut and seed butters, and not actually nuts and hard things. But you want to focus on those whole plant foods. But even if you are choosing to eat animal products, the number one principle I want you to think about is whole foods versus processed foods. That is the simplest principle to follow. If you can center your diet around whole foods, that is going to set you up so much for success. And that's just a really great principle to follow. Now, for your younger kids, we do have to use some processed foods because their tummies are really small and they can't just they're not just going to be eating a bunch of raw vegetables and those kinds of things. We do want to cook their foods. We can use some cereals and some minimally processed foods, but that doesn't mean they have to be eating Cheetos. That doesn't mean they have to be eating goldfish crackers all the time, those kinds of things. Let's try to stick to whole foods as much as possible. So that's going to be the simplest principle to follow for healthy diet in children. Okay, and the last topic I wanted to address today, because we are in January, so we are right in the middle of cold and flu season, is how to keep newborns safe during the cold and flu season. So the first thing I recommend is that if your baby is under 2 months of age and they haven't gotten their first set of vaccines, that you try to stay away from the public as much as possible. So I do not recommend taking them out to restaurants or any places that are highly populated because there's just lots of viruses and bugs and all kinds of things around. So stick at home. You can go out for walks and, you don't have to be inside your house all the time, but I would not go to densely populated areas. Excuse me. And then if your child already has had their vaccines and you're starting to go out in public, then just be mindful. Take hand sanitizer with you, take sanitizing wipes, just be mindful of where you are because there's there are bugs everywhere, and there's some viruses that survive longer than others. So if you're touching the shopping cart, if you're touching different things in different places, you can be carrying that with you. So just remember to wash your hands, sanitize your hands before you touch your baby so that you're not bringing that home for your baby. And of course, if you have questions about your baby being sick and you're concerned, definitely contact your healthcare professional. Here at Nourish Wellness, we're happy to take your text or your phone calls and see your child as needed. Okay, so those are all the topics I had. And it looks like we have a question on Instagram from table 1.29. I understand the fruit juice, but does it apply to vegetable juice as well? That is a great question. I would say vegetable juice is definitely going to be healthier than fruit juice. So if you're just a juicing type of person and you want to introduce vegetable juice to your child for whatever reason, I would say that that's definitely going to be healthier, but I still would try to keep it at meal and snack time. And in between meals and snacks, just water. Okay. So definitely vegetable juice isn't going to, it's very low in calorie density. If you just like now they sell green juices at the store, so you can look and see, okay, it's like kale and celery and ginger and those kinds of things. It's very low in calories. It's going to have lots of antioxidants. So if you're trying to get a bigger bang for your buck and you want a juice, that's great. But you can also just get it from whole foods as well. So that is a great question, table 129. Thank you so much for that. All right. Any questions anybody else has for me? Pop them in now. I will hang out probably, let's say 4 to 5 more minutes if anybody else has any other questions. Okay, let's see. Underscore Gina15. Are you accepting new patients? Yes, we are definitely open for new patients. So just look up nourishyakima.com. You'll find our phone number there. You can text or call if you are looking for a pediatrician for your children. Thank you so much for that question. All right. Are y'all liking Medical Monday? Are you hoping that I can continue this trend every Monday and see how long I can continue it to pop on here and stick to the schedule? We will see. Like I said, this is like my 3rd or 4th time trying. So just let me know, leave your comments. Let me know if you like this and if you want me to come on every Monday, talk about some new medical papers that have been released that pertain to pediatrics or lifestyle medicine, answer a few questions, address some topics, and then we will keep doing it. Jenna Vogel, thank you so much. We love Jonah too. Thank you for watching. Okay, so yes, we will continue doing it. Encourage me, send me all the encouragement so I can continue this as a habit. All right, everybody. Thank you so much for joining. And we will see you next Monday, same time. So I'll do 1:30 p.m. Pacific for 20 to 30 minutes, depending on how many things there are to talk about and how many questions there are to answer. And you can also go to the Nourish Yakima Instagram and DM questions ahead of time if you want. The more material y'all send me, the more I can talk about and the easier it is for me. So it makes it easier for me to pop on. That way I don't have to prepare as much because answering questions is pretty easy for me. It's what I do for a living pretty much every single day. So thank you all so much for joining. I had so much fun and I will see you next week, Monday at 1:30 p.m. Pacific. Bye, everybody.